Good morning, everyone, and thank you very much for the invitation to this wonderful event. It is always a great pleasure for me to participate wherever I am asked. This time, unfortunately, I could not be in person since I am conducting a live training session at our school in Cordoba, Spain. However, I did not want to miss the opportunity, so I am leaving you this video, which I believe carries an important message for all health sciences. I hope you will enjoy it. Today, I am going to present to you a very important concept in rehabilitation, but even more so in this field of sport. In this area, we are always looking for better performance and athletes who does not get injured and one who can reach their highest potential. Many times in health sciences, we do not realize that dysfunctions of the craniofacial system can affect the posture of the whole body and its overall health. What we imagine even less is that this can directly impact to the performance of an athlete. And yet, this is exactly what happens, not only with the regular patient, but even more with the athlete, who is like a precision machine and needs all systems to work in perfect harmony and balance. This essential balance is the true key to athletic performance, as we will see later in this presentation. And NPR, myofunctional postural rehabilitation, is the science that allows us to identify and treat this very important problem. NPR is a specific method of diagnosis and treatment that integrates different techniques from health sciences. Its diagnostic goal is to allow us to see the patients through the same lens, a perspective that makes possible a truly holistic diagnosis and a genuine interdisciplinary treatment. This method allows us to achieve a true physiological integration of all body systems, which results in an harmonious function of the organisms. And this becomes even more important in sports, especially when it comes to optimizing the performance of an athlete. Let me show some dysfunctions. Let us look at this patient. At the first sight, it seems as if one arm is shorter than the other. But if really, in reality, when we place the two cotton rolls between the teeth, the arm magically appears to close. This is a clear sample of how a craniofacial dysfunction can affect the entire muscular chains of the body. Now imagine this same situation in an athlete. The consequence for performance and injury risk can either more significant. Here we see combined problems: the mouth, posture, and the eyes, all interfering with each other. This interaction directly affects the health of the patient. And when it comes to an athlete, these interferences translate into a clear loss of performance. Here we see another patient showing dysfunctions that clearly affect health. Later we will see how these dysfunctions, when present in an athlete, can translate into constant injuries and, of course, a significant reduction of in performance. Let me talk now regarding the postural balance. The balance of the body depends on a proper balance of the mind, the structure, and the biochemistry of the organisms. Only when these three elements are in harmony can we achieve a truly good and efficient function. And now, let us see how this dysfunction can affect the muscle chains of the body. As a consequence, this altered change have a direct impact in posture and movement, which inevitably reduce the performance of the athletes. The muscles of the craniofacial systems are an integral part of the body's muscle chain. When there is a dysfunction in this system, the entire chain is altered. Both hyperactivity and hypoactivity create imbalances that lead to dysfunctions on the muscle chain, with clear consequences for posture, health, and athletic performance. Here we can clearly see how a change in mandibular posture can affect the posture of the whole body. Now imagine this translated to an athlete, where even the smallest imbalance can compromise movement, increase the risk of injuries, and reduce overall performance. Let us now talk about how to measure these dysfunctions and how, by doing so, we can prevent injuries in athletes and at the same time improve their performance. The posturometer is an objective instrument and a very necessary one in the field of sports. It gives us clear, measurable data that helps us guide both diagnosis and treatment with scientific precision. Posturometry is the science that studies and measures the static posture of the human body. It allows to measure a static posture balance and to relate it to activity of the postural receptors, mainly the eyes, mouth, and feet. Through this analysis, we can see if these systems are in balance with each other or if they are altered. Finally, it helps to analyze what has caused the pathology within the postural tonic system. Going now to the structure of the posturometer. This machine, essentially designed, is able to detect the distribution of load in correspondence with three fundamental zones of the foot: the first metatarsus, the fifth metatarsal, and the calcaneus. By analyzing these 3 points, we can obtain objective and precise view of how the foot is supporting the body, which is essential for both clinical diagnosis and athletic performance. That is a very important goal with a special protocol of diagnosis for this machine. The distribution of the body weight to the ground occurs through each foot, and it is transmitted by the tibiotarsal joint. Understanding the distribution is fundamental because it influences balance, postural alignment, and the efficiency of movement. In the following proposal, we will see how this distribution can be analyzed and how it relates directly to posture and to athletic performance. The objective is doing this test is detect and demonstrate interferences of each of the main postural receivers. This includes the oculomotor system, the craniofacial system, and the foot support. By analyzing these three receivers together, we can better understand how these functions interact and how they influence both health and performance. We see that in the following slide. Let's look at some athletes together. You know him very well. Right? We can see the changes in the face and the head that occur when he corrects the craniofacial system. The athlete's posture and function improve in harmony and balance. This athlete becomes an example of stability, showing better performance and suffering fewer injuries. A perfect machine. Now we have a look to more samples of craniofacial imbalance and how it influences injuries in athletes. Roger Federer, with much greater balance, experienced fewer injuries throughout his career. On the other hand, Rafael Nadal, with more craniofacial and postural decompensation, suffered more frequent injuries. This comparison highlights how balance in the craniofacial system can make a real difference in athletes' performance and longevity. Another clear example is Ronaldo. Through his career, he showed a sign of craniofacial dysfunction. This imbalance was associated with higher number of injuries, which had a significant impact on both performance and longevity career. Here we can see that when the craniofacial system is dysfunctional, the athlete loses strength. This is the reason why many athletes instinctively open their mouth during a sport. It is an attempt to compensate this imbalance. However, this compensation comes at a cost. It reflects dysfunction, reduced efficiency, and increased risk of injuries. Here I show you two athletes. In one, we identify craniofacial dysfunction. We neutralized the mouth with the B.E.D device, body equilibrium device, and performed a strength test. First, without the B.E.D, and then with the B.E.D in place. Both athletes showed an improvement in strength of about 25%. This clearly demonstrates how the craniofacial system, when dysfunctional, can reduce performance, and how correcting it restores power and efficiency. You see the balance here after the programming. Here you see the test of force with bed and without bed. Different groups. And when the body balance is in place, they improve the performance. The same here. Another dysfunction of craniofacial system. We correct it after the bed, better body weight distribution. After the programming, we apply different tests with bed and without bed, and both of them with bed improve the body balance and increase the performance on 25%. In conclusion, prevention must begin at the young age. That's very important. Good posture is always a sign of good health. When we achieve true balance, the body expresses its real power without the need for additives. This way, injuries are avoided and performance is improved in a natural, physiological way. And let us remember, it all begins when the coach understands and applies this knowledge. Thank you very much for your attention. I truly hope this presentation has been useful for you. And I also pleased to announce that we will be opening our school in Dubai in 2026. The coordinator will be Dr. Osman Laban, a highly experienced physician who has been working in Dubai for more than 30 years. He will be a coordinator, a very nice professional. So I am sure that next year we will have a pleasure to meet together in person in the next meeting. Thank you very much for your attention. And follow us in our social networks to stay updated with all our news, events, and courses. We look forward to welcoming you in our school, in our training center. See you in the next presentation. Bye bye, everybody.